Gianna, at noon, if you want to go ahead and let everyone in, and then I'll can start into the introduction. That sound all right?
Yep, I'll do it at noon on the dot.
Cool. Good afternoon, everybody. Thank you so much for joining the Primary Care Innovations webinar series, supported by the H. James Free MD Center for Primary Care Education and Innovation. Before we get started with today's presentation, I wanted to cover a few housekeeping items. First, throughout the presentation, please mute your audio and turn off video during the presentation, as we'll be recording this for future viewing on our website. Again, you can link to the past webinars that we've presented in this venue at primarycareinnovations.cme.ufl.edu. So if you'd forever like to be a part of this webinar, you're welcome to leave your video on, but we recognize most of you probably don't, so you'll want to turn your video off. If you have any questions that come up throughout the presentation, please use the chat function to type those questions. I'll help moderate a Q&A session at the end of our presentation today. To claim 1 hour of CME credit for this session, please complete the evaluation, which will be provided at the end of the session today. And then I'll announce this at the end of the presentation, but next month on October 9th, we'll have another webinar, a student-led model for providing LGBTQ plus directed healthcare. So welcome you to join us again next month on the 9th for another very interesting webinar. Today, we're thrilled to have Dr. Kimberly Castillo, Dr. Denise Schintrup, and Dr. Luisa Echeto join us from the Colleges of Nursing and Dentistry at the University of Florida, and will be sharing their innovative nursing and dentistry partnership. Dr. Castillo is a family nurse practitioner at the Archer Family Health Center, UF College of Nursing's primary care clinic in the town of Archer, Florida. She received her BS in Business Administration from Bucknell University in Lewisburg, Pennsylvania, and after graduation worked in New York City in marketing and advertising, and then changed directions and joined the Peace Corps. And spent the next 2 years as a volunteer in the Dominican Republic, where many of her favorite projects involved health promotion and education. After returning to the US, she switched gears and headed into a career in nursing, earning her BSN, MSN, and doctorate in nursing practice from University of Florida. She's focused her work on advancing health of the disadvantaged and marginalized. Dr. Schintrup is an Associate Dean for Clinical Affairs and Clinical Director of the college's nurse-led practice, Archer Family Healthcare. She works to promote faculty and clinical practice and provides administrative oversight at the Archer Family Healthcare She's a practicing family nurse practitioner and an instructor in the Doctorate of Nursing Practice program. She's a board member of the National Association of Rural Health Clinics and works to promote rural health. And finally, Dr. Aceto is a director of patient assignment and screening at the University of Florida's College of Dentistry. She teaches prosthodontics and predoctoral and for predoctoral and resident courses, and serves as a clinical director for the predoctoral prosthodontics program. Thank you so much for presenting today. Looking forward to hearing about your program, and I'll turn over the talk to you. Thanks so much.
Okay, let me see, I'm trying to share my screen here. Can you guys see our screen? Good, okay, great. Well, welcome everybody. Thank you for joining us. We are going to be talking about a project that we have embarked on starting January of 2019, and it is a nursing and dentistry partnership for health. Oh, let's see, there we go. So in this presentation, what we're going to talk about is we're going to describe the process that we utilize to create and implement a nursing dental partnership. We're going to talk a little bit about the successes and challenges that we've had with this project. And we'll also talk about some preliminary results that we have achieved with this partnership. And we're really proud of some of the things we've been able to accomplish here. We're also going to discuss what the impact of COVID-19 has had on the project, because we thought that it was very important to demonstrate some of those things that we have come up against with this pandemic. And then we're going to talk a little bit about some next steps for sustainability of this project after our funding is ended, what we would like to see happen with this project. So the way that this project came about was that we identified some gaps in care here at Archer Family Healthcare. We are a rural health clinic. We are under the umbrella of UF Health, but we're owned by the College of Nursing. So all of our providers and staff are employees of the College of Nursing, and we are our own little entity here out in Archer under the umbrella of UF Health. Many of our patients have no insurance, or they are underinsured. About 40% of our patients have no insurance at all, so they fall under our sliding fee scale. And then the rest of the patients have a variety of different insurances like Medicare, Medicaid, commercial insurances. We are funded, we have several funding sources, some federal dollars, we have state dollars, and some county funding that help us to operate, in addition to revenue that we generate from our patients who have insurance. So here at Archer, we have identified these patients as having limited access to dental care. There were lots of different reasons that we speculated that this was occurring, mainly, of course, resources, patients not having enough money to pay for dental services, not having any insurance to cover their dental services. We also noted some limitations in where we could send patients. Some of it had to do with transportation. Some of it had to do with just fear of going to the dentist and so forth. We also wanted to create an avenue for interprofessional education for our students, because we do know that that is very important to bridge the gap between the different professions in order to provide quality care. So we started a relationship with the College of Dentistry, doing some other initiatives. And when this funding opportunity came about, we decided to try to formalize the partnership, and then in turn provide care, quality care to the patients, of course, and increase their access. On the dental side of that, the College of Dentistry had discussed with us at the College of Nursing that they were concerned because they did not see a lot of their patients having a primary care provider. So on their end, they were screening patients for things like blood pressures, diabetes, but they really had nowhere to send the patients to if they needed primary care. So we thought, well, hey, we are primary care, so let's get together and we will build this partnership so that we can connect not only our primary care patients to dental, but if dental needed a referral source to a primary care, that we would be available for those patients as well. And again, same thing with doing this, we wanted to support interprofessional education with the students as well. So we were able to apply for a funding opportunity from Florida Blue Foundation. And with this funding, we proposed that we were going to bridge the gap between dental health and primary care on both sides. So create this interprofessional, intercollaborative relationship where we could get our patients from Archer, which is the clinic down at the bottom in that picture, to the College of Dentistry, and in turn, get the patients from dentistry to primary care, hopefully our practice. So in our proposal, we had to come up with what we were going to do year 1, 2, and 3. So the first year, really, we had spent developing the infrastructure within the campus-based dental clinic. So the dental clinic has this wonderful facility over there, and they were interested in having some medical presence in the dental clinic to help facilitate medical histories, help the students learn more about the medical side of taking care of patients and looking at the patient as a whole, as opposed to their dental, not just, but their dental issues. So we wanted to create a space where we could have a provider in the dental clinic. So we modified some of the clinic space in dentistry. We created clinical contracts and all of those administrative things that are necessary for a provider to be in the dental clinic. And we assigned one of our faculty to the College of Dentistry clinic to be the medical representation on the dental side. On the Archer Family Healthcare side, we proposed that we wanted to have somebody on our end who would be that liaison to help facilitate services for dental, help facilitate patients getting to dental care. So we proposed to hire a licensed clinical social worker, and she was going to be housed at Archer Family Healthcare and be that person that would take care of the relationships, getting the appointments for the patients, doing that with dental. So there was that connection between the two places. We also developed a bidirectional referral workflow, of course, because once we decided, yes, we're going to be able to refer directly to dental, we had to create that workflow so that would run smoothly. And then, of course, collecting data and figuring out how we were going to collect that data. So that's what we proposed to do. And then, of course, in year 2 and 3, we proposed to continue what we were doing and continue to collect that data to see what our impact is, and then decide, is this something that's worthwhile? Do we want to continue this relationship? Do we want to keep the nurse practitioner at the dental clinic? Where are we going to go after the funding ends? So that's something that we're still in discussion with, and we're hoping that we can continue that relationship. So now I'm going to turn over the presentation to Dr. Kim Castillo, and she's going to talk a little bit about what we have accomplished with within the short amount of time that we've had with this project.
Hey everyone. So this slide breaks down the demographics of all the patients in the program. So you can see 583 patients were part of the program. These included patients referred from Archer to the College of Dentistry, those referred from the College of Dentistry to a primary care clinic. Now that could have included Archer Family Healthcare or any primary care home that they desired. And then patients who saw our licensed clinical social worker. So either for a brief intervention, for counseling, or even to help with patient assistance paperwork. So pretty even male-female, slightly more females, 74% Caucasian, 23% African-American, 2% identified as other, 1% Asian, and 13% Hispanic. The majority had insurance or not reported, and 21% had no health insurance. And then the vast majority at 91% had no dental insurance. Looking at the next slide, year 2 so far has similar percentages mirrored to 2019. So our outcomes from year 1. So again, we had 583 unduplicated patients. There were 691 encounters by our LCSW. The nurse practitioner who was embedded at the College of Dentistry provided medical consultation to 16 patients. 134 referrals were sent to the College of Dentistry from Archer Family Healthcare. And of those, 55 completed appointments, or 41%, and 15 did not show up for their appointment. There were 25 referrals from dentistry to Archer Family Healthcare, and then 10 completed appointment, or 40%. The outcomes for year 2 up until August of this year, we had 147 unduplicated patients, 38 encounters by our LCSW through March. The nurse practitioner over at the College of Dentistry saw 10 individuals. We had 40 referrals sent to the College of Dentistry from Archer. 7 completed their appointments, 33 are pending. We had 1 referral from dentistry to Archer, which was completed. So you can see certainly COVID has been a major barrier in the program this year. We had 4 measurable objectives for the program. So the first is that 60% of dental patients referred to Archer diagnosed with uncontrolled diabetes will demonstrate a 0.5 improvement in A1Cs within 6 months of treatment. So we had 2 patients come over to us from the College of Dentistry with diabetes, and that data is still pending. The second objective, 60% of dental patients referred to Archer diagnosed with uncontrolled hypertension will demonstrate a 10-point reduction in blood pressure within 6 months of treatment. So we had 8 patients come over to Archer from the College of Dentistry for hypertension, and 88% of those met the blood pressure goal. The third, 60% of dental care participants will establish a primary care medical home as indicated by their medical record. So 280 reported having a primary care medical home, 99%. So this is actually significant because the assumption made prior to the start of the program was that most of the patients seen within the College of Dentistry would not have a primary care provider, but that actually wasn't the case. Now, we don't know how long ago it was that they actually saw a primary care provider. It could have been years ago, but they at least identified a primary care home. And then the fourth objective was that 40% of healthcare participants will establish a dental care home as indicated by their medical record. So we had 55 Archer Family Healthcare patients who established a dental home at the College of Dentistry, beating our goal at 41%. So we've identified several successes and challenges on Archer Family Healthcare's end, and Dr. Acchetto will address those at the College of Dentistry on the next slide. But the first success was that we were able to connect Archer Family Healthcare patients to a dental provider. Last year alone, 55 of our patients established with the College of Dentistry who may not have seen a dentist anytime in the near future or if ever. In addition, we were able to provide primary care to patients who did not have a primary care home before. Challenges, communication, coordination, staffing. It can be very difficult to coordinate meetings between 2 very busy clinics and understand what information is important for the other to know. From a staffing perspective, the LCSW at Archer left the university this year to pursue other interests, leaving us without a key member of the team. And lastly, despite easing the process of establishing with a dentist, there were still many barriers for Archer Family Healthcare patients to complete their dental appointments. So of the 134 patients referred to the College of Dentistry last year, 79 did not go to their appointment. We did contact patients from March to November of 2019 who didn't complete them. And of those we were able to communicate with, the number one reason was cost. Despite the College of Dentistry offering very competitive pricing, it was still too expensive for many of our patients. The next barrier was time constraints, and either they felt they couldn't take off of work, they had other specialist appointments, and they perceived a dental appointment not as important as their other ones, or they had no one to watch those they cared for, such as kids or elderly relatives. And then the next barrier was confusion with the process of the dental appointments. And then in smaller numbers, lack of transportation, fear of the dentist, and other dental opportunities that came up beforehand. So moving forward, the Florida Blue funding was transferred from the LCSW position to the nurse practitioner position. So there will not be a gap in data collection or exchange. We plan on scheduling Archer Family Healthcare and College of Dentistry team meetings with regularity. And Archer Family Healthcare will continue to promote the services of the College of Dentistry. So during our visits, primarily chronic disease follow-up and physicals, the nurse practitioners and nurses will continue to educate our patients about the importance of a dental home, the connection between oral dental care and their overall health, and that poor oral health leads to increased risk of chronic diseases.
So definitely in the side of the dental school, the College of Dentistry, we
Sorry about
had
that.
a
Go ahead.
great, no, we had a great success with the introduction of having a nurse practitioner included into our staff members and in the college. A lot of the times the students, when they're doing treatment planning, when they're talking to the patient about the medical histories, they need support from the medical field. And having her there has given us the opportunity to, again, integrate dental with medical and make sure that our patients are treated comprehensively and not just looking at their dental needs. So we have identified several of them that actually reported not having medical or a physician, and definitely having a door and an opportunity to refer patients to the Archer Clinic has been definitely a success for us. The nurse practitioner also is helping us, teaching our students how to do the patient examination, what are the right questions that you should ask, how you should take blood pressure and monitor the blood pressure correctly, how you should do glucose screening. And it has been, definitely a good support for our dental students. Again, the challenges has been not having maybe enough time of the nurse practitioner with us. She has been with us only twice a week. So she's not available in every single session that the students are there. And at the beginning, she was actually stationed in one of the team clinics that we have in the dental college. So what we did is we have established a new centralized screening clinic where we evaluate the patients from the first time, and we go ahead and do complete medical history to identify those patients that might require some medical consultations or require some medical evaluation before proceeding with dental procedures. So in this screening clinic is a perfect opportunity for us to actually have her station. So we have actually moved her to this clinic now, and instead of stationing one of the dental clinics, she is now stationed in the screening clinic and have the opportunity to actually talk to every single new patient we have established in the college. It gives her the opportunity as well to meet the dental students. And by having this opportunity now, dental students know that she's available when they have, when they need her and when they have any concerns. So this will also increase the amount of patients that the nurse practitioner will actually look at. because we definitely identify in the first year of the program that we didn't have enough encounters of the nurse practitioner in the dental clinics. But by having her in the screening clinic, she will have the opportunity to see at least we're trying to screen 12 to 15 patients every session. So she had the opportunity to see all these patients in the screening program. So the next slide, please. So one of the challenges that we have with COVID is that unfortunately, yes, we lost the connection with Archer family. Unfortunately, a lot of the clinics, we have to close. We have to close the dental school from March 13 to June 15. So having this closure, we definitely didn't have the opportunity to continue with the connection and continue with the process. We couldn't refer patients there and they couldn't refer patients to us. The screening clinic was one of the clinics that actually opened last. We just started the screening again on August the 24th. So we just starting to pick up, starting to get patients again, and it has been working very well, having her in the screening clinic and having the opportunity to identify those complex patients. So next slide. The next step is definitely trying to look for best opportunity for both the nursing schools as well as the College of Dentistry, and trying to definitely improve our relationship and having, again, comprehensive care of our patients and teaching our students, the important part of the medical field into our dental field. We're definitely going to need IRB approvals to continue with analysis of all the surveys and all the data. And then, of course, continue reviewing all the workflows and to continue to having communication between both of us so we can increase this program and have, a bigger amount of patients and students taking advantage of the program.
Yes. And I just want to also interject here on that piece with the students. So because of the complexity of figuring out the timing between the nursing students and the dental students, we've had a lot of challenges trying to get those surveys done with the students. And once we had come up with a plan, then that's when COVID hit. So we weren't able to continue to figure out the best time to screen the students because everybody was gone. So that definitely is a gap that we are trying to look at how we can address that with this program. And then just another update, we have finally scheduled a meeting with everyone next week to get back on track and continue to move forward with this important project. So that ends our presentation, and I know we're probably have a lot of time left for questions, so that's good. So
yeah, absolutely. Thank you. This is really a wonderful collaboration. Comment from our chat box. Again, if folks have comments, questions, please put them in the chat box, and I'll try to keep an eye on this and pose them to our speakers. This is a question, excellent model of interprofessional education and patient care here at UF, really nice to see. I can understand the issues with the social worker. I assume no reimbursement for services. Let me, a couple suggestions, may suggest additional models to consider in the future. First, you could place a dental hygienist in the Archer Clinic, can actually perform a variety of dental services under general supervision of a dentist at dental school and get reimbursed. Can do patient education referral to the dental clinic. And then we are doing this right now in several FQHCs, and it works. Too bad about the COVID interfering with your very nice project. And then a second option, when dental therapists are approved in Florida, you can place a dental therapist in Archer Clinic and have them perform basic dental services under the dentist. I think that was already noted there. But congrats on a very nice project. So yeah, one of the questions I had was just given the rural nature of Archer, was that considered an option about having some dental services there to cut down on commute, or was this always thought of as being kind of a co-located, or not co-located, but in the standard place for the dental and medical services?
So I can speak to that. I just want to make one correction to that, to those comments. Because we are a federally designated rural health clinic, we can bill for a social worker. So that was one of the pieces that we were also trying to promote was, getting reimbursement for the social worker services. She was a licensed clinical social worker, master's prepared, and had almost completed her doctorate, and then completed it during the time she was here. So her contributions were reimbursed once we got her numbers and things like that. So that was really a plus for us because we had never had that service before. As far as having dental capabilities out here at the clinic, we have explored that, and we were looking into ways that we could do some dental procedures here and simple dental care. Some of the things that were challenges and roadblocks were the equipment that's needed. So we would have to put in some resources in order to get the room ready for that. And that is something that we would really like to do, especially with the dental therapy profession that is becoming very popular. And I would love to see somebody out here who could do that kind of stuff and get our patients simple things like tooth extractions. I mean, I don't know if that's simple, but those kinds of things that they can't get to the dentist for whatever reason, and come here and be able to have those services done.
Absolutely.
Dental cleanings, all of those things.
Excellent. And Cesar Migliorati, I'm sorry if I mispronounced your last name. If you want to turn your mic on, it sounds like you had a comment or a question.
Migliorati, you are muted and we cannot hear you.
Okay, thank you all. Sorry.
There you go.
It's Friday. I just want to, first of all, to thank Denise and the team at Archer Clinic and the College of Nursing for believing in us. And when we first started talking about this project, it looked like a long distance shot, but we have it now a reality. I want to keep people to keep in mind that one of the goals of this is an interprofessional collaboration. So in addition to having someone dental working at the Archer Clinic, we plan to have our dental students to rotate there sometime in the future, because the goal is for our dental students to learn to work with other healthcare professionals. And this would be a perfect environment for that to happen. With the changes that we made in terms of location of the medical nurse in our clinics, the contact she's having with our students now is much more intense, and the students learn about her presence and can request her services when they are seeing patients who are medically compromised in our clinics. So all of this, it's a learning experience. It's the first project that we do together, and we really hope that we'll be able to continue with this activity after the Florida Blue funding runs out. So thank you all so much.
And to piggyback on that, one of the things that we're hoping to do as well is have our nurse practitioner students work with Dr. Figueroa and see what she does there, and get an idea of, again, the experiences with dental, what they experience on their end, in order to better be able to collaborate and with dentistry when they're graduating as well. So we're hoping that after maybe in the next month, we can get that going as well. We're not sure yet. We're still have to figure that out. So
it sounds like the building on this kind of interprofessional collaboration clinically is absolutely wonderful. Do you all have any set of talks that lead up to that to kind of prepare the students for entering that kind of interprofessional environment? Or is it basically the kind of learning on the job in those clinical settings?
Well, when we originally wrote the grant, um, I I neglected to put anything about the students because I was really thinking about the patients, you know.
Mm-hmm. Mm-hmm.
So when we met with Florida Blue, they said, absolutely, this is something that we would like to see this happen. So once we got that established, what those outcomes were going to be, we kind of had to, first we had to do the first part, which was get everything set up. And then it was almost like we're going to focus on the students after we finish setting this up. However, it seemed like things hadn't fallen into place the right way for the students until we had met in February. I think Dr. Miglerati and Dr. Ichetto and I had met, and we were getting ready to go. We had the surveys ready, and then COVID hit. So no students at all. So we have to circle back and get that reestablished again, and figure out when we're going to disperse the surveys, and because we would like to do a before and after to test their knowledge and their understanding of each of the professions. So that's what that survey is about. It's a before their experience and then an after. So we have to capture them at those certain times. So hopefully we don't have to put that out further. We're hoping, so we'll see.
Wow.
But yeah,
that's great.
That's one of our goals.
Excuse me, out of this relationship, we had a parallel activity where Dr. Shantra participated in a diabetes session where we taught our students about diabetes and how important it is for when you're providing dental care to know about patients who have diabetes. We taught the students how to do the blood glucose testing, and that is now offered routinely to our screening patients. They are offered the possibility of having that test done. So we are trying to build on this relationship in different ways.
Mm-hmm. Excellent. That's great. And then Dr. Olga Luaces, I apologize again if I mispronounced your last name.
That was perfect. Thank you.
Oh, great.
Hi, everybody. My name's Dr. Olga Luasis. I'm a clinical faculty with the College of Dentistry, and I'm in the Department of Community Dentistry. Dr. Ichetto actually recently became my faculty mentor, so I got so excited to listen in on this awesome webinar and such a great initiative. It certainly piqued my interest because part of what our department does is we have portable dental equipment and we go out into the communities to provide our services. Our services do focus on preventive care, and we have in the past traditionally focused mainly on children. And we've had our programs in schools, like school-based sealant programs and things like that. Just before COVID, the Rotary Club of Gainesville gave us funding for these really awesome portable units that give us the capability to perform a lot more than just preventive services. They have the capability for, high-speed handpiece, attachment, and all sorts of things. So we can also now offer restorative care and things like that. I think it would be great, if you all are interested to discuss a possible collaboration with our department where we can perhaps set up the equipment at the Archer Clinic, and this can certainly address the barrier of transportation. And also maybe the opportunity to have dental students and nursing students rotate in the programs that we hold in the elementary schools. We have the second year students rotate with us. I think this could be a great opportunity for the third and fourth year students to get that interprofessional experience as well as the experience with working with older adults. So I just wanted to throw that out there, and I actually emailed Dr. Ichetto about it as the presentation was going on, but yes, just she has my email, so let me know if that's something you would like to discuss in the future.
Yes, definitely. We would
Awesome.
definitely be interested in that.
Thank you, Olga. Yes, we'll definitely talk about this opportunity. Yes.
Good.
Wonderful. The another comment from Tina Trelor. Santa Fe College has a hygiene program, and we would be happy to explore the possibility to help support the clinic's dental needs. So that may be another collaboration and possibility for you all in the future as well.
Great.
Any other comments for the group before we wrap up for the day? One last.
Last thing I wanted to say is actually in the dental school, in the screening clinic, we work together as well with Santa Fe College. We identify those patients that work well and we refer them there, and they refer patients to us, and Florida Blue the same way. So we're definitely creating a very good partnership around hygiene, nursing, and College of Dentistry very well. So thank you everyone for the support.
Mhm.
Yeah, I had one more question for you all. I mean, the high number of individuals identifying a primary care medical home was surprising to me. I wouldn't have expected 99% to have identified as having a primary care medical home. Did you look at how many of those were identified as some of the health safety net centers, Helping Hands, mobile clinic, equal access clinic, just to name a few possibilities? I was just curious as to if those were kind of appropriately being identified as their primary source of primary care.
No, I didn't look at the different types of primary care centers that they were assigned to.
Yeah.
So with that information, so what that information was gathering was if the patient that was presenting at dental needed a primary care referral for whatever reasons, if their blood pressure was elevated and they needed to go back to their primary, then those were the individuals that we were looking at to see if they had a connection to a primary care, and if that primary care responded to the referral. That was another piece of it.
Got
But
it.
so within the dental packet that they have to fill out when they come in, they have to identify, or there's a space where they can identify who's their primary care. So that's where we gathered that information.
Got
If
it.
there was no, so they could say, the problem with that piece of data is they could say anybody, but we don't know when they went there.
Yeah.
But they
What
did
the history was.
identify somebody. So that was what was interesting to me, is that there is they have the knowledge that there is, a primary care person that they affiliate with or associate with, but I don't know how long ago that they had been there. We didn't have that information.
Got it. Got
So
it. No, this is a really wonderful project. What I love so much is you have patients who are having a touch with our healthcare system, and instead of just saying, oh, follow up your kind of linking to care, and helping make that connection and get folks the care they need, which is so important to actually function like a system.
Yeah, and I think also it makes us better as providers, because prior to this, when a patient would need to go to dentistry, we know that UF Dentistry has a clinic, so we would just tell them, well, you have to call, or you have to go there to the in the morning, and they have a lottery system at some point. We didn't really even know what the process was. So this has really helped us to help our patients understand the process. Here's what happens. They have to do a screening first. Most of the time you go to the dentist and you just go. You call them up, make an appointment, and go.
Right.
Well, because it's a student, there's students there, there's some other things that need to be done evaluation wise. And we didn't know any of that prior to this. So knowing that, it really helps us to say to the patient, look, these are the steps that have to be taken. So it might take a little bit more time, so don't get too frustrated, but just giving them the reassurance that it will happen. And now we know how it happens, and that really provides them with more knowledge and information that we didn't have prior to this. So that's the part that I really like about this.
Wonderful.
Yeah.
Well, thanks to all of you for taking the time out of your schedule to present. Thanks for those that signed on to listen about this really wonderful project. Sounds like some additional collaboration coming out of today's webinar, which is exactly what we're hoping for with this series. And I'm very hopeful that you all, and excited to learn about the program further as you all get on your like all of us, get back on your feet after COVID and figure out the workarounds you're going to need. And looking forward to hearing more in the future. So thanks so much. For those that joined for the session, please evaluate the session to receive CME credit. And then join us on October 9th for Primary Care Innovations webinar, a student-led model for providing LGBTQ plus directed healthcare. We'll look forward to seeing you then. Everyone have a nice weekend. Thank you.
Thank you. Bye.